Welcome to the McLean Hospital Crafting Support Project 2024 Family Webinar Series. I'm Dr. Julie McCarthy, and I'm a clinical psychologist and researcher at McLean Hospital. Tonight, I'm very excited to have you join us for a presentation on mental health first aid and an interactive discussion with one of our own, Joanne Grady Savard, the Director of Peer and Family Support Services at McLean Hospital. First up for our agenda, I'll be going over a brief introduction of our crafting support project for anyone who might be a little bit newer to this webinar series. Then we'll dive into what mental health first aid is and how it could be applicable for your life or your community. And then we'll spend the last half of our presentation tonight doing a Q&A with Joanne Grady Savard, and then we'll end with some closing remarks. So first up, as we get into why we are all here tonight, I'm going to launch a brief poll on who we have with us. All right, so if you don't mind, please feel free to answer the question, what best describes your role? Family member, person with personal lived experience with mental health challenges, clinician, none of the above, or you can have intersecting identities across any number of these roles as well. And I'll share the results in just a moment after we close the poll in 3, 2, 1. Okay, so sharing the results now, we have the majority of our audience as family members. Thank you for joining us. That's about 80%. We also have several people who have lived experience with mental health challenges themselves, clinicians, and people who identify in categories outside of these as well. So thanks for sharing. And if there's any specific ones that you think I should add, definitely feel free to get in touch. Okay, all right, so for why we are all here, it could be for a number of different reasons. Ultimately, the Crafting Support Project is something that we put together starting last year, and it was really coming out of this growing, very real need for family services for people who had loved ones navigating mental health recovery. And so for any of us, whether it's from our own personal experience as that person with mental health challenges or in the support person role for someone else, or as a clinician too, we may have all found ourselves in a situation where we wish we knew what to do or what to say or how to say it a little bit better than we did at the time. And so hopefully through the course of this webinar, series, we all will feel a little bit more confident or knowledgeable about how we might be able to help the people that we care about the most, help folks in our workplace, and to also improve our own well-being in the process. So this year, we have a number of different topics. Today, we're talking about mental health first aid, and we've already covered some topics as well, including peer specialists, law enforcement, motivational interviewing, recovery, involving peer specialists and CRAFT. And then we have a number of topics coming up later as well. So feel free to stick with us if you are interested. And also if you are interested in recordings from last year where we focused on community reinforcement and family training, or CRAFT, and we have a working relationship with the folks who created that approach, feel free to check out our YouTube channel where we have those recordings, as well as a recording from one of our peer specialists on the Wellness Recovery and Action Plan. All right, so the other part of the Crafting Support Project, which is a philanthropy-funded initiative through McLean, is one-on-one coaching with people like me who are trained to work with many of the family members like you who might be on the call. Right now, we're offering this for up to 8 weekly one-on-one sessions on Zoom with me or someone trained by me through the end of this year. And we're targeting McLean families right now who've had loved ones specifically experiencing psychosis in one of our programs. And there is no cost to you. So if you're interested, feel free to sign up with me at jmccarthy@mclean.harvard.edu. So now we're going to talk about the topic for today, mental health first aid. And so I'd love to get a sense of how familiar folks are with this idea, this term. And so I'm just going to put a little poll out there for you to please answer how familiar you are with mental health first aid as of right now. Unfamiliar, you're new to mental health first aid. Minimally, you've heard the term mental health first aid before this particular webinar. Moderately familiar, maybe you've read a bit, learned a bit, some details about mental health first aid, or very familiar. Maybe you've already been trained in mental health first aid, or you are a trainer, or have received some services or presentations on this topic more in depth. Okay, so we'll close the poll in 3, 2, 1. And it looks like the majority of folks with us today are new to mental health first aid. So you're definitely in the right place. And we do have some folks who have, heard something about this idea before, some people who have looked into it, and at least one person who's been a bit more engaged. So thank you so much for wherever you're coming from with your familiarity with this topic. And if you have insights that you'd like to share with us or questions as we go, again, please feel free to let us know. Those are the results. Okay. All right. So to start off, I wanted to think a little bit about what the definition of mental health is to begin with. And the Oxford Dictionary would say that this is a person's condition with regard to their psychological and emotional well-being, which is interesting because a lot of times when we think about mental health or services or getting help for mental health, we're often focused on what's not going well, per se. And so I just want to highlight that this is something that we can all talk about as something to maintain in a strengths-based way, and it doesn't always have to be a problem. And then also to really think about mental health being on a spectrum. There are definitely times and places where we need help for this, and times when things are going fabulously. And all along the way, we have the ability, the opportunity to think about how to promote mental health for ourselves and others as well. And so when we think about this idea of mental health first aid, if anyone's ever been trained in CPR or other types of first aid, it's kind of nice to think about if there were an emergency, we would know a little bit about what to do, maybe how to start asking for help or addressing the needs of someone in the moment before professional help arrives. And similarly with mental health first aid, it's an approach that has come out of Australia and is adapted to the United States. And it's really a pretty well-structured course of information that teaches how to identify, understand, and respond to the signs of mental health challenges that people might be experiencing. And this training can give you skills to feel more confident to reach out and offer initial help and support to people who may need it, specifically folks who may be in the process of developing a mental health or substance use problem, or maybe someone who has an established problem in that area and might find that those things are exacerbating a bit for them. And this is also applicable for people who are experiencing a crisis as well. And so just as importantly, what mental health first aid is we are not talking about going through a course on this and feeling like, okay, we're ready to go to diagnose and treat all the mental health things. And this is not necessarily the case, and definitely not legally licensing anyone as mental health professionals per se. This is really geared toward anyone in the community, inclusive of mental health professionals, but certainly not making people mental health professionals. And also this can be really helpful for people who are encountering others or for themselves, people who are going through having suicidal thoughts, for instance. However, it's not meant to or necessarily going to prevent something like suicide from occurring. And also we talk about being able to offer assistance and support in the moment. However, it's not putting you on the hook for providing long-term care necessarily as part of the mental health first aid approach. That being said, you might be in a role with a family member, a friend, a significant other where you may also be providing long-term care or even professionally. However, that's not within the scope of mental health first aid alone, okay? And so some of the benefits of this approach, and I speak from recent experience, having become an instructor recently myself with the support of Joanne, thankfully. We have benefits for people who get the training, just as mental health first aiders themselves, to find that you have increased mental health literacy, which just means you kind of know a little bit more about what to look for with respect to mental health, wellness and concerns in that area, being able to recognize more signs and symptoms, and then also have more mental health literacy with respect to knowing what options are out there for community supports, for professional supports, and knowing kind of how to connect people with those supports in a more effective way. It also helps to increase confidence and likelihood to help people who are experiencing distress, as trainees. Sometimes even for myself, as a clinician, there have definitely been times in my life where it's felt more or less comfortable to broach a conversation with someone where you think, gosh, maybe something's going on, something's a little bit different, maybe they need help. Um, we might know how to have those conversations really well with certain people in our lives, certain contexts, maybe clients, maybe certain family members and certain friends, but we may feel way less comfortable with that with other people, depending on their views about mental health or the type of relationship that we have with them, and or maybe the space that we're in our own life at that time. And then another benefit of mental health first aid is that it's been shown to reduce stigma and it can increase empathy that we have for other people. And I think that this is particularly important when we think about the negative views that people might have about a particular diagnosis, or maybe that someone's using substances, or things that might make it harder to connect in a supportive and non-judgmental way with someone who actually could benefit from our support. All right, and all of these benefits are supported by a number of different research studies as well. All right, so now we'll move into what we might be encountering or what might make us even think about using something like mental health first aid. So some of those things are what we call signs and symptoms. So even though we're not necessarily diagnosing people, there are important things that we can look for and listen for as we're interacting with the people around us. So signs are referring in this context to things that we see or observe that could represent a mental health challenge. So this is something that is a bit more objective, something that other people around a person might be able to tell, could be a change in what's going on. Symptoms in this context are markers of mental health challenges, that a person can feel. So it's much more internal. Other people around them may or may not know that those symptoms are even occurring, which is why it's so important to think about how we can open up conversations with people so that we're not guessing, we're not making assumptions about what is or isn't going on. Because I've definitely talked to a number of people, clients, family members of loved ones too, where it feels like you're putting on a facade because it's more comfortable in some ways to say everything's good, everything's fine. And so because we are aware that there can be, yes, observable signs and also not observable symptoms, it can be really important to think about, well, how do we get at what's going on in a way that's respectful of people and evidence-based as well. And so some of the things that we can look for across these signs and symptoms might be changes in someone's appearance, how they look, how are they dressed, what does their self-care look like? And then this is all relative to, what their typical baseline might be or typical behavior. Specific behaviors themselves in terms of people doing things that they didn't used to before, maybe things that might be odd, out of the ordinary. Behaviors also apply to what someone stops doing. So are people avoiding talking to you or responding to texts or emails? Or do they stop going to work, or they're going late to school? Things like that. Or maybe they're not hanging out with friends as much. So any of those things could be examples of different behaviors. Or it could be, picking up substance use. So any type of action or inaction. And then in terms of thoughts, these could be things that people are verbalizing. So it might come up more in conversation with someone or in a digital communication about what's kind of going on under the hood with someone in terms of their internal experience. And then the feelings, certainly those very internal symptoms or experiences, could be feelings that, maybe are a little bit more distressing to people, or they're lasting longer than they usually do, or people aren't really bouncing back to the way they normally would in the events of stress or different life events that we all experience where our feelings might go up and down, um, or the quality of those feelings might have different levels of intensity. So any of the changes that we might notice for ourselves or in anyone else could be a little indicator of, maybe I could use mental health first aid skills here. So the action plan that mental health first aid equips us with is something called ALGE. So this stands for A, approach, assess for risk of suicide or harm. L, listen non-judgmentally. G, give reassurance and information. E, encourage appropriate professional help. And the second E is encourage self-help and other support strategies. And all along the way, we want to keep in mind this idea of assessing. Why? Because the situation could change, especially how I had mentioned, we want to avoid making assumptions about people. Being able to go into a situation with a hypothesis instead of a, rock solid conclusion will help us be adaptive and help us be able to provide the best assistance or information or perhaps suggest the appropriate professional help that's most needed to that individual that you're talking to in that particular situation. So we'll go into a little bit more in depth each of these right now. So first, with the assess skill, we can kind of think about, well, what are those things that we're assessing for? So in broad strokes, there are two types of situations that we can think about. One, situations that could become a crisis. So examples might be someone having a panic attack, noticing aggressive behavior, having some problems with substance use, but functioning still maybe generally going okay, non-suicidal self-injury, where someone might be harming themselves in some way without trying to end their life. Or is this an immediate crisis, like a medical emergency? Someone's unconscious or someone needs an ambulance like right away. Or is there a substance use crisis, like an overdose, or people are expressing more active suicidal thoughts and behaviors, or someone's experiencing severe psychosis in such a way that maybe they're not acting in a way that's based in reality or in such a way that could hurt themselves or others based on those different beliefs or hallucinations like hearing voices or seeing things that just make it harder for them to keep themselves well because their assumptions of reality have changed in that moment. Okay? And then the approach skill is getting at, assessing for risk of suicide or harm and assist. It's kind of, well, how do we do that assessment in some ways? What do we say? And so there are countless ways that you could approach someone. And so these are just a few examples. So some less helpful approaches, though everyone might perceive these a little bit differently, could be things like, I understand exactly what you're going through. I've been through that too. This could seem like a tempting option in some ways because you might be trying to validate what someone's going through. However, sometimes this can rub folks the wrong way in terms of kind of missing the uniqueness of someone's personal situation that we may or may not have the full story on. Another less helpful approach at times might be, you've got so many good things going for you. How could you be upset right now? Relatively speaking, you're in way better shape than so and so. I think that this one, though it's super positive and we often promote positive communication in a lot of circumstances, sometimes this one can be a little bit dismissive or minimizing of what might really be going on with someone, and can discourage the idea of getting help because maybe it feels like I shouldn't need help in that moment. Some more helpful options that you could consider are things like, you haven't been coming to lunch with us lately. Are you okay? And another one could be, it seems like something's been bothering you. Would you want to talk about it? And how long have you been feeling this way? So things that are kind of questions where we're not coming in with judgment necessarily, but we are thinking about what we're noticing, right? Like a change in behavior, not coming to lunch as much. That's an example of a change in behavior. And not assuming that there's a problem necessarily. So asking, like, are you okay? or saying it seems like something's bothering you means like maybe something's going on, maybe not. And then putting the choice to the other person about whether or not they want to talk about it, not forcing them to talk about it. And then asking them, how long have you been feeling this way? That way you can kind of get a sense of, is this really a change from how things were before, or is this not? And it kind of depends on your relationship with that person to know what that's like. And so somebody asked in the chat, why the first question may not be so helpful. The I understand exactly what, and I touched on that a little bit. And, just want to clarify that I've been with people in some of these trainings where the same approach can be viewed differently by two different people. So it might be that one approach would be so helpful and supportive for somebody. Like, I understand exactly what you're going through. I've been through that too. For some people, that might mean, wow, I'm not alone. Thank goodness. So that could be more or less helpful depending on where you're coming from. So these are just some examples based on some folks that I've gotten some feedback on during some of these trainings. However, if you feel like that's helpful for you, give it a try. If you think that's going to be helpful for the person that you're talking to, that's fine. And part of the assessment with the approach, it's iterative. So if you try one approach and you think, oh, that's not landing, you can try a different one too. Okay. All right. And so then the next skill is listen non-judgmentally. So we've got verbal and nonverbal cues that we could look for. And so I'd love for you to put in the chat, if you're up for it, some examples of some signs of verbal, like the things that you can say, or nonverbal cues like body language that would show you that someone's listening non-judgmentally to you. What comes to mind? So nodding, yep. What else do we think? And it can just be whatever you personally think. Oh, eye contact, yep. Nonverbal, looking at you in the eyes. And also with that one in particular, keeping cultural considerations in mind can be helpful too, because some people find eye contact very respectful, and this is what I'm trying to do to give you my attention. For other people, it might be a little bit less comfortable or more respectful to actually have less eye contact. So everyone's a little bit different there. Someone mentioned, listening in the car while driving with someone, just taking that time to listen, not doing the talking. Other people are bringing up things like body language, leaning forward. Don't look at your phone. Super important too. Give your full attention when you can. And oh yeah, someone also brought up, that one of their family members has autism, and eye contact might be uncomfortable for that individual. And with respect to another sign of non-judgmental listening, the not doing anything else and not fidgeting, if you can help it too, can help you feel like, okay, I've got you, I'm listening, and I'm not here to judge one way or another with whatever you want to say. Okay, thank you so much for everyone who shared their thoughts in the chat. Other things that can be helpful when listening non-judgmentally is avoiding making assumptions. It's really hard to do. Many of us think about what's going on and we have a little bit of a hunch, and that's why we're starting the conversation, and that's fine. However, we can try our best to keep our assumptions at the door so that we can be open for noticing whatever the person is willing to share with us. And as we are practicing listening, and this also goes with the assistance part too, trying to keep in mind that it can be hard to accept help, never mind seek help, can be something that goes a long way with being non-judgmental. So just because we might suggest getting help or not doing something, whatever someone feels comfortable with at the time, we can try to meet them where they're at. And if you have any negative judgments, and we're only human, you can feel free to just edit that out of the live conversation and maybe save that, to file away for the future. Oh, and someone else puts in the chat, they might sit on their hands, if you talk with them, and if that's too much, for that situation, you can leave that out if you like. And then also the tone of voice can help too. If you sound interested and engaged versus a flat tone, that could be something that shows that you're genuinely wanting to listen. Okay, thank you. All right. So the G is for give reassurance and information. We've got reassurance that can be a statement, a comment, or behavior that can help reduce someone's stress or fear. Something like, losing a job can be tough. It's natural to feel upset. To really show that there is not judgment there. You're reassuring that it's okay to be upset in that moment. And then also to show reassurance in terms of your own support. I'm here if you ever want to talk. No pressure. The information piece is a bit more specific about knowledge that can help someone understand an idea, review options, and consider some next steps and highlight when they may need further assistance or support. So this could be, hey, you're not alone. I care about how you're doing, and I've noticed a change in X, Y, or Z. Even the sharing what you've noticed might be information that other person didn't have before. Sometimes it's hard to know what's going on with us sometimes without looking in a mirror. And so sometimes the other people around us can be that mirror in appropriate ways. Okay, and then the E for encourage professional help can include options like therapy, individual, group, or family, medication, rehabilitation programs where people might stay over somewhere or maybe be in an inpatient situation. And we can remember as we're encouraging professional help, if they feel less comfortable talking to us in the moment, that's okay. We can encourage the person to speak with someone else that they do trust. Maybe it's a different family member. Maybe it's a friend. Maybe it's a therapist or a peer specialist. And we never want to threaten hospitalization. If someone's going to the hospital, you can just talk about that they're going to the hospital. Making threats and kind of hanging that over someone's head can create a really uncomfortable power dynamic with people. And so trying to stay in a collaborative place and an honest place can go a long way too. And being patient can help because I have definitely worked with people where I thought professional help could be a great idea and they were not ready for that move, and that's okay. And so we can keep the door open to discussing help in the future. And let's see. So the encourage self-help or other support strategies is a great part of the action plan that can help whether or not someone wants to pursue professional supports. So we can include coping strategies, things that can help us stay well and help us respond to stress in the moment, like relaxation exercises, physical activity, keeping healthy nutrition and sleep, and having social connection. We know from the literature that social support can buffer the effects of stress and actually help us feel better. We also have community resources available to us like support groups, different education. And then we can remember that even though this isn't professional help, a person may not be ready or interested in self-help either. And that's okay. At least we are planting the seed. And if you'd like to learn more, and Joanne will talk about more in a moment as we start our question and answer, feel free to check out the website mentalhealthfirstaid.org. And McLean does have a working relationship with them as we've recently hosted a training on just this topic. So thank you so much. And before we move into our Q&A, I would love to hear a little bit more about people's preferences for perhaps learning about mental health first aid training for yourself. So this quiz is launching right now, and it's just asking which training would be best for you. A 1-day, maybe 5 to 6 hour training on a Saturday, a 2-day training split up into 2 evenings, like maybe for 3 hours on a Tuesday evening and 3 hours on a subsequent Tuesday evening, or the same format on a Wednesday or a Thursday. Feel free to let us know what you feel like you'd be able to and interested in attending, if any. And if not, that's okay too. We're trying to plan some mental health first aid trainings that we'd like to offer in the future. And so trying to think about where we can meet you all where you're at too is something that we really want to prioritize. So if you have any final preferences, please feel free to put them in the poll now. And I'm going to close it in 3, 2, 1. Okay. So sharing the results, most people would prefer a one day on a Saturday to kind of get it out in one go. That might make it easier for scheduling in some ways. And then for the 2-day, we have a lot of different ideas about, Tuesdays or Wednesdays or Thursdays. So we will definitely keep all of this in mind. Thank you so much. Okay, so now I am very pleased to introduce Joanne Grady Savard for our Q&A. So as the Director of the Peer and Family Support Services, Joanne has leveraged her lived experience as a caregiver to many loved ones living with mental health challenges. In her role, she has hired 3 certified peer support specialists who work within the units at McLean in Belmont and at our McLean Southeast campus. These individuals provide hope, resources, and provide a post-discharge support to many people working on their mental health recovery. And as a family advisor, Joanne facilitates support groups, one-on-one consulting services, and manages a resource library to launch time-sensitive referrals to caregivers as they navigate the mental health care systems, which we all know we could always use help navigating. So as an entrepreneur with a degree, a bachelor's in organizational behavior, Joanne founded a staffing consulting firm in 1994 that she managed for 30 years. Joanne is the co-chair of the Patient and Family Advisory Council at McLean, and she's a former board of director for the National Alliance for Mental Illness, or NAMI, for the state. And she's now a family advisor for the UMass Chan Medical School Department of Psychiatry in the iSpark Center, which is the Implementation Science and Practice Advances Research Center. So thank you so much, Joanne, for joining us. I'm going to stop sharing my screen so we can have a little Q&A.
Thank you so much, Dr. McCarthy. It's such a pleasure to be here. And I so enjoy your presentation. It's really inspiring and really educational. So thank you so much.
Thank you. And if it wasn't clear before, Joanne is one of the mental health first aid instructors that we are fortunate to have at McLean. All right, so one of the questions that has come in the chat so far is about with the idea of saying, I'm here if you ever want to talk approach. How do you set boundaries when a person repeatedly comes to you and you can't guarantee that you'll always be available, or you're starting to feel burnt out? I know this is a question that's come up sometimes before from family members and clients that I've worked with. So what are your thoughts on that, Joanne?
Yeah, so that's a really good question. And it's really relevant for myself at this moment in time. When we go back to algae, something that I learned from first aid mental health, as it relates to an experience that an ongoing experience that I have with a loved one, I'm always going back to the assess and approach. That's the A in algae. My loved one refuses, to have any type of treatment or medication. And she has been living with a serious mental health issue for many years. As a matter of fact, she has been hospitalized several times. Fortunately, she is now clean and sober, and that's wonderful, terrific. And at the same time, she chooses not to access other treatments. So for me, I tend to be an enabler and a natural caregiver to my loved one family members. But when I go back to algae and she has called 3 times a day, or, is really depending upon me to give her direction, I always go back to the assess and approach, where I say to her, you are not alone. And I'm wondering if these types of questions or resources that you're asking me can be assessed through either your 12-step program, or would you consider maybe seeking other resources for yourself? So again, acknowledging ways in which I can support her. I will never leave her alone, but I also need to set up my own boundaries. And that's the other thing I've learned from first aid mental health, is how to also practice my own well-being.
Yeah,
Did that answer your question?
Oh, yeah, we got it. Thank you so much. Yes, it looks like it did. Yeah, thank you for bringing up the point of self-care. So for folks who do the training, that's definitely part of this, right? Not just how we help others, how we help maintain our own mental health well-being, because that's just as important too. And so, I'm curious about how you even started learning about mental health first aid. And would you mind speaking a little bit to how this got on your radar or what drew you to this approach?
Absolutely. So I've always been curious from a very young age about strengthening emotional and mental health. And the reason for that, when I grew up, I grew up in a very, how can I say, large Irish Catholic family. There was a lot of disruptive behaviors that went on, and no one spoke about it. It was this code of silence. But I knew intuitively that it was not a healthy environment. In addition to addiction, we also had psychosis, and we had, mood disorders, etc., that were sort of left to go on. So it was interesting because I started reading self-help books when I was, probably in elementary school or certainly in high school. So I've always been curious about this. In my community, this was probably maybe 8 years ago, I saw a community organization that was offering first aid mental health. I thought, what is that? I've never heard of it. But when they said it's like CPR, I said, I am taking that class. It was free. It was a one-day class. I went by myself. And it was just terrific for me. Initially out of the gate, I felt more confident on having a new language. So that's how I got introduced to it.
Thank you so much. Yeah, I think that confidence is key, because even if we know what to say, the courage it takes to actually say it, knowing that someone might look at us funny, someone might deny that there's a problem, or someone might shut us down, that's a risk, in putting ourselves out there and our concerns. So, yeah, I'm so glad to hear that you feel more confident. And I feel like the skills that I've learned, about how to talk with clients, family members, I mean, that improves my confidence as well, too. Yeah. All right. So we've got a couple of additional questions. One is, you know, from the mental health first aid lens, perhaps, what do you feel like might be a helpful way to talk to a son who has delusions about the CIA and, that this family member is collaborative with the CIA?
That's almost going to make me cry because I have been there. That has been part of my lived experience.
Okay.
So I would spend a lot of time trying to rationalize with my loved ones about, trying to give evidence of how that's thinking is not appropriate. And what I was doing was judging it. And the more that we judge that type of behavior, the more our loved ones dig their feet in, and then they don't want anything to do with us. So what I have learned is to meet folks where they're at. And if we go back to algae again, it's going to tell us how to act, to assess an approach, how to listen non-judgmentally, and then also to give resources. So as an example, what I had to learn with that type of thinking is to listen and then offer non-judgmental feedback like, that does not sound like it makes sense to me. It may make sense to you. That does not make sense to me. And so I wonder, would you consider validating that thought with other people? That individual, they might say, absolutely not. No, I'm not going to talk to anybody. And so you may say something like, this is out of my wheelhouse. I love you unconditionally. And I am not the one to speak to about that type of thinking. I'd like to invite you to think about other people you can speak to about that.
Thank you for sharing your lived experience. It's so useful in terms of thinking of how we can invite people to have conversations with others, that it doesn't have to just be with us. And that also gets at somebody's earlier comment or question about those boundaries. What is the support that we are able to offer? And in the moment, yeah, we're not recommending that we argue with people about what the truth is of the matter with things like the CIA necessarily. And instead, you can agree to disagree perhaps, and then also try to find the common ground of, well, okay, you know, regardless of what the nature of the belief is, how is it impacting how you feel or your behavior or what's going on or what could be helpful. So I like the idea of inviting them to think about other resources, and we can also ask, so we don't have to make assumptions about, what they think is needed. Is it just someone to talk to, or some additional support or reassurance too? Go ahead, Jane.
Exactly. And what I learned in first aid mental health, because I would always go to, oh my goodness, this is psychosis or schizophrenia or bipolar. And that wasn't my role. I'm not a psychiatrist. So what I learned is to say, okay, if you're worried about the CIA, that must make you feel really scared. You must be full of fear. Agree with them, tap into their heart, let them know that you're not going to jump down their throat or change them. And because I love you unconditionally, what can we do so that fear can be subsided? My experience is family members are usually the worst to give any type of advice. Because they're not going to. That's just my experience. Sorry.
Does anyone like to be told what to do? Probably not. But even if we have great advice.
Of course we do, right? And at the same time, what I've learned is to engage other advocates.
Yeah, thank you so much for sharing that. So another one of our questions is, let's see, does the training go into more depth about how you determine if your loved one is experiencing a crisis, like is suicidal, and when it might be necessary to call an emergency professional help, 911, or other emergency community mental health care?
Well, one thing that I learned in first aid mental health, this is so interesting. It was so critical. I was always worried to ask if my loved one was suicidal. I always, I might have had that feeling and concern, which for me promoted helicopter behavior, like, when did they come home? When did they go to sleep? That type of thing. What I learned in mental health first aid is that how to create a compassionate, truthful narrative. And so if I experienced that thinking and I had evidence, either not eating or cutting, I learned to say, are you thinking of killing yourself, and do you have a plan? And I look directly in their eye. And when you do that, you need to be prepared for what the feedback may be. And mental health first aid teaches us that. It's a really hard question, and I have done that. And I have taught other people how to do that. And I do have an example where a mother literally saved one of her son's lives.
Thank you for sharing. And I think that's one of the toughest topics and questions that we might encounter, with a loved one, or it could be a neighbor, a colleague, anyone who we might encounter. And yeah, knowing what to do, I think, is so important, because you're right. Asking the question invites an answer and an unknown. And so I think that fear sometimes of what the answer might be leads us to not want to ask at all. And
100%.
So, what's at stake here? Sometimes it is people's lives. And so I think, yes, to the point about the question of training, the training goes into more specifically all types of scenarios, different types of crises, different types of mental health challenges that people could encounter, and specifically how to offer support for those different types of experiences, because it's not a one size fits all. And any of those situations for different types of symptoms that people could be experiencing may escalate to a crisis or not. So yes, the training does go over that in more detail. All right.
Thank you.
So another question that we have is, can our organization help with finding a family therapist to help chart out the possibility of a loved one coming to live with you when you're not sure this is the best outcome for either of you? I'm not sure if you can speak to that, Joanne, or if you'd like me to. What do you think?
Oh, I think that's such a wonderful question. And Dr. McCarthy, I'm sure I would like for you to speak to that, but from my lived experience, what I've learned to do is being a natural enabler and caretaker. I'm fully in at my own consequence. So I have learned, if that is a question I have, I speak to my professionals, either a therapist or, a family dynamic coach that we use, that type of thing, because I understand I don't always have my best interest at heart. So that would be my feedback. So how about you, Dr. McCarthy?
Thank you. That's such a great answer. I think that it depends on certainly where you are in terms of services that McLean specifically, for instance, can offer. For insurance-based services, people typically need to be in the state, often being able to come in person, though there may be some remote options. And, actually even being able to potentially consult with someone like Joanne, I know that's part of your role, sometimes helping to navigate different resources or referrals and whatnot. If you don't already have a connection to a therapist or provider through our organization or a specific organization near you, you don't have to navigate the search alone. I'm not going to guarantee that whether it's Joanne or me or someone else in our group, that we'll be able to 100% get a referral per se. However, there are definitely people to talk to, support groups that people can go to, even our, let's say if you call the admissions and if a particular program is not able to help you, they may be able to provide referrals or ideas of who else might be able to. So that is a great question, because I think that so many people might be able to benefit from a family therapist. And then the question is, okay, great, I'm in, the family's in, how do we get started? And there are also great online resources as well. Things like Psychology Today is just a large directory of people who describe the types of therapy approaches they do, whether that be family therapy or individual therapy. And folks from lots of different organizations are listed there, ours included. All right, so thank you for that question. Okay, so another question is, how long does it take for mental health to get better? So there are lots of different ways we can answer that. Do you want to take a first stab, Joanne?
Sure. So through our Moms Collaborative community, we've had a couple of clinicians talk to us, psychopharmacologists, psychiatrists, therapists, whatever. And something that they usually say is mental health is treatable, 100%. It's not always, how can I say this? Recovery is possible and probable. It depends upon the condition. It depends upon the approach and the individual who is the center of concern, how motivated and how willing and open they are to get the resources. So there is no roadmap. Patience is really important. So that would be my feedback.
Yeah, thank you. I think to validate, this is a question that any of us would ask and would want answered.
Yes.
Clients who work with me, the first day that we might meet, the question will be, well, how long is therapy? How long do we meet? How long do I need to be on this medication? Might be a question for a prescriber. And so it's natural to want to know the answers. Fortunately, with things like research, we're learning more and more what are the predictors of things getting better sooner for people, or risk factors for, things being a little bit more challenging. So I think that it is quite an individualized course, for recovery, in the absence of, let's say, any intervention. That being said, if a person is working on themselves with their self-help or other supports or getting professional help, that might change a little bit differently or more quickly. If the family members or friends or support environment around that person is changing and doing things a little bit differently, then we also might see more positive change too. So there are a lot of factors at play. And I really like, Joanne, how you're highlighting that recovery is a very normal part of our language now. It used to not be the case. And so I think even in the course of my time in the field, there has been a big shift from you have to do something forever to, hey, let's go to the minimum effective dose of medication, or let's think about, one of the goals of therapy is, cycling out of that when it's no longer needed. And that's going to be different for everyone. Okay, so another question is, do you recommend or prefer mental health first aid classes that are in person, virtual, or a mix of both, or is there no meaningful difference between them? What do you think, Joanne?
Yeah, so from my experience, just the type of learner and my personality, because I love engaging with people, for me, it was most effective to do it in person. However, I know individuals who have taken it online, and for them, it was the best. They couldn't travel, they were working, they needed that flexibility. So to put that question back to to each one of us, what is best for our schedule, our well-being, our learning style, and our timing?
Thank you. I think that there are benefits to either modality. I did the mental health first aider training virtually, and then I did the instructor training in person. And I too loved connecting with people in person, and also the bulk of my research and clinical work is, often online. And so I do think that whatever works best for individuals makes sense, but just know, at least from my experience having done both can be very positive experiences. Okay. All right. So any final questions? Oh, let's see. We've got, okay, if it takes longer for someone to get motivated in spite of medical treatment, therapy, and counseling recommendations, what can the caretaker do? So it's sort of the situation that you've kind of touched on in the past of what can a caretaker do if you feel like someone needs help and they're not yet ready to get it?
Yeah, that is such a really good, important question. So what I have learned is to meet individuals where they're at.
Mm-hmm.
If they are not ready or unwilling or unable to, I think it's important to acknowledge that and to support that at that moment in time. And at the same time, don't give up. Keep advocating. When the time is right, when you feel as if they may be open, continue to present the resources that you believe are correct for them.
Mm-hmm. Yeah, thank you. And then we'll do one more question and then we'll move to closing comments. So let's see. Oh, I think it might be a bit more of a comment. So someone says, I try to think of it as a chronic illness or something that will work for a period of time and then needs may change, just like it would with diabetes, cancer, or any other chronic illness. Great point. That this kind of goes back to the assess, right? Like someone may really need help today, and after time, things may change, and that need may no longer be the same. Maybe we need more help, maybe less, maybe different help. So thank you. That's such a good point, and I think that's a nice example of how other types of health experiences are similar in terms of the course of care and treatment. Yeah, okay, great. Well, thank you so much for sharing your insights and your time, Joanne, with us. And I'm going to just put our slides on the screen so folks can see what else might be of interest to them before we sign off for today. So in terms of resources and additional supports, we have Joanne's wonderful Mothers Collaborative Community Group here Tuesday evenings. If you are interested, we also have other groups that are geared towards specific types of experiences for family members. And if anyone has any questions about these, let me know. I'm going to put a resource sheet in the chat that also has a little bit more by way of example, so feel free to check that out. And our feedback survey. I'm going to give folks a couple of minutes to start filling this out. If you would like to share your views on, what this webinar was like, what you'd like to see from us in the future. And I'd really like to thank everyone who's made this possible, especially our philanthropy support that was gifted to our division. And next month, we have a family webinar, Thursday, September 12th from 5 to 6 p.m. And our topic will be on empowering caregivers through psychosis education and skills training, an overview of the Psychosis Reach direct-to-consumer training program. So this is specific to people who have lived experience or, caregiving experience with whether it be family members, friends, or others in your life who've experienced psychosis. And so having done one of these workshops or trainings myself, I think it's a really nice overview of background education to feel empowered to know what psychosis can look like and really some helpful skills as caregivers or as people working with people who are experiencing psychosis, kind of what to say, how to have those tough conversations or approach in ways that I think can be very much so complementary to the mental health first aid approach, but a little bit more specific to psychosis and coming from the CBT or cognitive behavioral therapy approach that geared toward family members. All right. And so if anyone has any questions, feel free to get in touch with me. Again, I'm Julie McCarthy and my email and phone number are there. And thank you so much for all of you for spending a bit of your evening with us. And thanks again, Joanne. Take care, everyone.
Thank you very much. Have a nice evening.
You too.